Hello, I'm delighted to be here on World Children's Day to talk about a subject that is close to my heart. My name is Helen Brough. I am a consultant in pediatric allergy, and I trained first as a children's doctor and then in allergy. I'm also an adjunct reader at King's College London, and I'm here on behalf of the European Academy of Allergy and Clinical Immunology as the chair of the pediatric section for this society. I've been asked to give you a highlight of this meeting that I chaired called the Pediatric Asthma and Allergy Meeting. This was the biggest pediatric asthma and allergy meeting from IARCI that occurs every 2 years and happened just over a week ago. These are the chairs that organised the committee, and I'm very grateful to Stefania Arasi, Alina Sprinkelman and Nicolette Arens for their role in organising this large focus meeting. These are the other organisers and the IARCI headquarters that made it possible. So it was a large meeting with 1,282 delegates and 113 abstracts of people around the world bringing their latest and newest information and developments in pediatric asthma and allergy. We had 97 faculty from over 24 countries and 50 educational sessions. This is just a diagram of all the different places that we had attendees from, and this is one of the benefits of being able to hold our meetings digitally. This is just a summary of some of the different countries that attended the meeting in larger numbers. So this is my first slide, looking at one of the top tips of the Pediatric Asthma and Allergy meeting. In this excellent pro-con session, led by Professor Louise Fleming, who's a consultant pediatric respiratory doctor in the UK, and Michael Banier, who's a consultant pediatric pulmonologist in the Netherlands, they talked about some of the changes recently in the recommendations for the management of mild asthma. And this was based on the new guidelines for the Global Initiative for Asthma. We know that mild asthma comprises 50 to 75% of all asthmatics. However, it can also comprise between 30 and 37% of children that end up with acute asthma in emergency. And also 16% of patients with near fatal asthma have what was thought initially to be just mild asthma. In this talk, they also stressed that overuse of short-acting beta-2 agonists, usually known as the blue inhaler or salbutamol, is actually likely to lead to more allergic inflammation of the lungs and an increased susceptibility to viral infections. That's not to say that if you're having an asthma attack, you should not use your salbutamol, but that for more chronic management of mild asthma, the Global Initiative for Asthma recommends that even in children with the very mildest of asthma, who need to use their salbutamol inhaler very infrequently, that if they're using their inhaled blue inhaler, the salbutamol, then they need to also use an inhaled steroid to deal with the inflammation in their lungs. So they recommended that for 6 to 11-year-olds, if you need to use your blue inhaler, you should also take 2 puffs of the brown inhaler, or beclomethasone, known often as clenilmodulite, 50 micrograms, 2 puffs twice a day. For children that were 12 years or above, they recommended using a combined inhaled steroid with a long-acting type of salbutamol called formoterol. So in summary, this was looking at a change in the way that people should be treating asthma, not starting off with just the blue inhaler, but immediately starting off with both the blue and brown inhaler, or another form of inhaled steroid if they are 2 years of age, which is combined with a long-acting form of salbutamol. Moving on, I'm going to talk about this excellent session that was led by Erik Melén from Sweden, and he talked about epigenetics, which is the way that our DNA or our genes interact with the environment. And it's not just important for asthma and allergy, that it's important for all conditions that affect the human body and also mental health. So he said this famous quote, "Hereditary deals the cards, environment plays the hand." And they talked about various different environmental exposures and the way that this impacts on genes. For example, they looked at smoking and they found that a father that smokes even before the child is born and then stops still impacts the onset of asthma in that child, and that a grandmother's smoking history also increases their grandchild's risk of asthma. So particularly when it comes to cigarette smoke, they showed that this can actually change the DNA of the child in utero. Moving on, they talked about Joost van Nerven from the Netherlands had an excellent session on maternal nutrition during pregnancy and in early life. And they looked at how this directly impacts on the genetics of the young infant, and how this then can lead to not just allergy and asthma, but also other chronic diseases like type 2 diabetes. Going into a bit more detail, Caroline Rodwit from Switzerland in Zurich talked about what it is within these foods that is actually making a difference. So there are foods that have fiber in them, high fiber diets like fruits and vegetables and whole grain cereals that are excellent in providing food for the good bacteria in the gut. The good bacteria in the gut then produces these things called short-chain fatty acids. And these are anti-inflammatory. And so they help not just with allergy and asthma, but also with other inflammatory types of conditions. This was an excellent talk by Karina Venter, who is a consultant dietitian in Colorado Children's Hospital in the US. She shows some of the data that she has analyzed looking longitudinally at children over 10 years and seeing which children developed food allergy and which did not. They looked at the diversity of food in that child's diet in early life, and they found that the number of foods that the child had introduced by 6 months of age was directly linked to how many food allergies they developed over 10 years. So for each food, whether that was fruits or vegetables or any food that they introduced, there was an 11% reduction in food allergy over 10 years. Then looking at the number of food allergens introduced by 12 months of age, for each food introduced, there was a 33% reduction in the amount of food allergy over the first 10 years of life. So this really gives us an incentive to try and get a rich dietary diversity into an infant's diet in the first year of life. And why is this? I talked about short-chain fatty acids, which is the product that is produced by the good bacteria in the gut when you eat a healthy diet full of fiber and healthy foods. So they have shown that by introducing these foods into the diet, this increases a specific short-chain fatty acid called butyrate. And this leads to a reduction in asthma, reduction in food allergy, and reduction in positive allergy tests. Finally, this talk by Harold Renz focused on the microbiome. We know about the hygiene hypothesis, but now we understand it's more about being exposed to bacterial products, and that the microbiome inside your gut is incredibly important in terms of determining whether you develop any chronic disease, but also allergy and asthma. Finally, I would like to thank the board members of the Pediatric section for the European Academy of Allergy and Clinical Immunology. You can see that we are represented from all over Europe, and I'm delighted to work with them on various projects to improve the well-being of children and provide educational opportunities for professionals working in pediatric allergy and asthma. Thank you very much, and let us celebrate World Children's Day.